The topic of the tutorial is larynx, and I, Dr. Alpana Kesar, will be covering this topic under the following subheads: functions of larynx, cartilage and joints that form larynx, ligaments and membranes present in larynx, inlet, outlet, and cavity of larynx, muscles of larynx and their movement, blood supply and lymphatic drainage of larynx, and nerve supply of larynx. This is larynx in the sagittal view. This is larynx when viewed from the back. In this visual, larynx has been marked. The functions of larynx are: larynx is an air passage. Air that enters the nose travels into nasopharynx, oropharynx, larynx, and trachea. Thus, larynx is an air passage. It is a sphincter that closes the lower respiratory tract during swallowing. When we swallow food from the oral cavity, the food goes into oropharynx and then into laryngopharynx and esophagus. At the time when it enters laryngopharynx from the oropharynx, the upper end or the inlet of larynx closes so that the food does not enter larynx or trachea. It is also an organ of phonation that has vocal cords present in it that helps in producing sound. Location of larynx is in the neck opposite third to sixth cervical vertebrae. Larynx opens into laryngopharynx above, and below it continues into trachea. Structure of larynx. Larynx is a hollow musculo-ligamentous structure with cartilaginous framework. The skeletal framework of larynx is composed of a series of cartilage. Cartilage are connected with the help of membranes and ligaments. Several muscles helps in moving the larynx. Sensory and motor innervation of larynx is by vagus nerve, which is the 10th cranial nerve. Larynx is composed of cartilage, membranes and ligaments, and muscles. There are 6 cartilage that forms the skeleton of larynx. Of these 6 cartilage, 3 are paired and 3 are unpaired. The 3 unpaired cartilage are epiglottis, thyroid cartilage, and cricoid cartilage. This ring-like cartilage is cricoid cartilage, whose lower border marks the lower end of larynx. The 3 paired cartilage are arytenoid, which also gives attachment to vocal cords, corniculate, and cuneiform cartilage. Membranes and ligaments. The architectural framework of larynx, which is formed by the cartilage, is completed by ligaments and membranes. There is 2 intrinsic ligaments and 1 extrinsic ligament or membrane. The 2 intrinsic ligaments are the upper quadrangular membrane, which is this, and the lower cricovocal membrane, which is this. Cricovocal membrane is also known as the cricothyroid membrane, which is attached below to the cricoid cartilage and above to the vocal cords. The extrinsic ligament, which is this, is called the thyrohyoid membrane, which is attached below to the thyroid cartilage and above to the hyoid bone. The structure of the larynx is completed by muscles. The muscles of the larynx are divided into two categories: the intrinsic muscles of larynx and extrinsic muscles of larynx. Intrinsic muscles of larynx are those muscles that helps in moving the inlet of larynx and the vocal cords, while the extrinsic muscles of larynx are those that helps in moving the larynx as a whole, such as elevation of the larynx. The intrinsic muscles of larynx include thyroepiglottic muscle, aryepiglottic muscle, posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoids, oblique arytenoids, cricothyroid, thyroarytenoids, and vocalis. The extrinsic muscles are thyrohyoid, mylohyoid, sternothyroid, and sternohyoid. Intrinsic muscles of the larynx will be done in detail in this tutorial under the category of muscles of larynx, and extrinsic muscles of larynx will be done in the tutorial of neck. Thyroid cartilage is the largest of all the laryngeal cartilages. It is formed by right and left lamina. The two lamina are widely separated posteriorly. Anteriorly, they converge and join each other. The most superior point at the site of fusion of the two lamina is called laryngeal prominence or Adam's apple. Just above Adam's apple is present a notch which is known as superior thyroid notch. As the two lamina join, there is present an angulation between the two lamina, which is more acute in men than in women. In men it is 90 degrees and in women it is 120 degrees. And thus laryngeal prominence or Adam's apple is more prominent in men than in women. The posterior margin of each laminae is elongated to form the superior horn and the inferior horn. The inferior horn has a facet for articulation with the cricoid cartilage. The superior horn is connected to the posterior end of the greater horn of hyoid bone with the help of thyrohyoid ligament. The lateral surface of thyroid laminae is marked by a ridge called the oblique line. The ends of the oblique line are expanded to form the superior and the inferior thyroid tubercles. The oblique line is the site of attachment of the extrinsic muscles of the larynx, namely sternothyroid, thyrohyoid, and inferior constrictor. Cricoid cartilage. Cricoid cartilage is the most inferior laryngeal cartilage, which is shaped like a signet ring. It has a posterior broad lamina with a narrow anterior arch. The posterior surface of the lamina has two shallow oval depressions separated by a ridge. The ridge is for the attachment of esophagus, and the shallow depressions on either sides of the ridge gives attachment to the posterior cricoarytenoid muscle. The cricoid cartilage has two articular facets. This articular facet is for articulation with the inferior horn of the thyroid cartilage, and this facet is for articulation with the lower surface of the arytenoid cartilage. Epiglottis is a leaf-shaped cartilage. The stem of the leaf is attached to the posterior aspect of the thyroid cartilage at its angle. This attachment is with the help of thyroepiglottic ligament. Epiglottis projects posterosuperiorly from its attachment to the thyroid cartilage. The upper margin of epiglottis is behind the pharyngeal part of the tongue. Arytenoid cartilage is a paired cartilage which is pyramidal in shape. It has an apex, a base, three surfaces, and two processes. The base of the arytenoid cartilage is concave and it articulates with the articular facet on the superior border of the lamina of cricoid cartilage. The apex of the arytenoid cartilage articulates with the corniculate cartilage. The medial surface of the arytenoid cartilage is covered with mucous membrane and the two medial surfaces face each other. The posterior surface of the arytenoid cartilage is smooth and is covered with transverse arytenoid muscle. The anterolateral surface has two depressions. These two depressions are separated from each other by a ridge. The depression above is for the attachment of the vestibular ligament, and the depression below is for the attachment of vocalis muscle. The anterior angle of the base is elongated to form vocal process. Vocal ligament is attached to the vocal process. Similarly, the lateral angle is also elongated to form a muscular process. Muscular process gives attachment to the posterior and the lateral cricoarytenoid muscles. Corniculate cartilage. Corniculate cartilage are paired conical shaped cartilage whose base is resting on the apex of the arytenoid cartilage. Cuneiform cartilage are paired club-shaped cartilage which are present anterior to the corniculate cartilage and are suspended in the airy epiglottic fold. Laryngeal joints. One of the laryngeal joints is cricothyroid joint. This is the cricothyroid joint which is present between the inferior horn of the thyroid cartilage with the cricoid cartilage. Each of the joint is surrounded by the joint capsule and is reinforced with ligaments. The cricothyroid joint enables the thyroid cartilage to move forwards and tilt downwards. This movement is brought about by cricothyroid muscle. This movement lengthens the vocal ligaments and produces tension in them. The second laryngeal joint is the cricoarytenoid joint. Cricoarytenoid joint is formed between the upper border of the lamina of the cricoid cartilage with the base of the arytenoid cartilage. This joint enables the cricoid cartilage to slide towards each other, slide away from each other. It also helps the arytenoid cartilage to rotate so that the vocal processes can either move towards or away from each other. These movements help in abduction and adduction of the vocal cords. Extrinsic ligaments of larynx. There are three extrinsic ligaments of the larynx. They are the thyrohyoid membrane, the hyoepiglottic ligament, and the cricotracheal ligament. The thyrohyoid membrane is a tough fibroelastic membrane or a ligament that is attached above to the hyoid bone and below it is attached to the superior border of the thyroid cartilage. In its lateral part is present an aperture through which passes the superior laryngeal arteries, nerves, and lymphatics. The posterior border of thyrohyoid membrane is thickened to form the lateral thyrohyoid ligament. The membrane is thickened anteriorly in the midline to form the median thyrohyoid ligament. Hyoepiglottic ligament extends from the midline of the epiglottis to the body of the hyoid bone. Cricotracheal ligament extends from the lower border of the cricoid cartilage to the upper border of the first tracheal ring. Intrinsic ligaments of larynx. There are two intrinsic ligaments of larynx, and they are the cricothyroid membrane, which is this, and the quadrangular membrane, which is this. Starting with the cricothyroid membrane. Cricothyroid membrane is also known as cricovocal membrane. It is also known as cricothyroid ligament. Cricothyroid membrane is attached below to the arch of cricoid cartilage, and above it ends as the upper free margin. This upper free margin is enclosed in the space within thyroid cartilage. The upper free margin is thickened to form vocal cords of larynx. Vocal cords are attached anteriorly to the thyroid cartilage, and posteriorly it is attached to the vocal process of arytenoid cartilage. The second intrinsic ligament is the upper quadrangular membrane. This is the upper quadrangular membrane. The upper quadrangular membrane has an upper free margin and a lower free margin. The upper free margin forms the inlet of larynx and extends between the epiglottis in front and the arytenoid cartilage behind. The lower free margin is thickened to form the vestibular ligament or the false vocal cords. The vestibular ligament is attached posteriorly to the arytenoid cartilage, and anteriorly it is attached to the posterior side of the angle of the thyroid cartilage superior to the attachment of vocal ligaments. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Inlet of larynx. Superior aperture of the cavity of larynx is called the inlet of larynx. In this visual, this is the inlet of larynx. The inlet of larynx is directed upwards and backwards. The inlet of larynx is present behind the tongue. It opens in the laryngopharynx. This is the laryngopharynx. The anterior border is formed by the mucosa covering the epiglottis. This is the superior margins of the epiglottis, and the mucosa covering it forms the anterior border of the inlet of larynx. The lateral border of the inlet of larynx is formed by airy epiglottic folds. This is the arytenoid cartilage present behind, and here we have the epiglottis. This fold of mucosa running from arytenoid cartilage to epiglottis is called airy epiglottic fold, and it is a fold of mucosa which covers the upper margins of the quadrangular membrane. The posterior border of the inlet of larynx is formed by mucosal fold called interarytenoid notch. Interarytenoid notch is a fold of mucosa that is present between the two arytenoid cartilage, and thus the name interarytenoid notch. The function of inlet of larynx is that it acts as a sphincter of the lower respiratory tract. The inlet of larynx closes at the time of swallowing. This prevents the entry of food into larynx and thus the trachea. Muscles that close the inlet of larynx is aryepiglottis muscle, and the muscle that opens the inlet of larynx is thyroepiglotticus. The outlet of the larynx is its inferior margin. At the inferior margin, the laryngeal cavity is continuous with trachea. It is completely encircled by the lower border of cricoid cartilage. Cavity of larynx. Cavity of larynx is a tubular structure which is lined by mucosa. There are two pairs of mucosal folds that projects medially from the wall of the larynx, and they are the vestibular folds above and the vocal folds below. The vestibular and the vocal folds that project medially from the wall of larynx divides the laryngeal cavity into three parts: the vestibule, the middle chamber, and the infraglottic cavity. Vestibule is the upper chamber which is present between the inlet of larynx and the vestibular folds. The infraglottic space is the lower chamber of the laryngeal cavity, which is present between the vocal folds and the inferior margin of the larynx. The middle part of the laryngeal cavity is also known as the laryngeal ventricle or the sinus of Morgagni. It is an expanded cavity which is present one on each side. This expanded cavity is present between the vestibular folds above and the vocal folds below. A tubular extension from the laryngeal ventricle known as laryngeal saccule is present, projecting upwards between the vestibular folds and the thyroid cartilage. This tubular structure contains numerous mucus glands. Mucus secreted by these mucus glands helps to lubricate the vocal cords. Rima vestibuli. Rima vestibuli is a triangular shaped space which is present between the two vestibular folds. It is present at the junction of the upper chamber with the middle chamber. Rima Glottidis is also a triangular shaped space which is present between the two vocal folds. It is present at the junction of the middle chamber with the infraglottic cavity. Rima Glottidis is a narrower space as compared to Rima vestibuli. Both Rima Glottidis and Rima vestibuli can be opened and closed by the movements of arytenoid cartilage and the associated fibroelastic membranes. Intrinsic muscles of larynx. There are 9 intrinsic muscles of larynx. The first 3 intrinsic muscles helps in opening and closing the inlet of larynx, and that includes aryepiglottic muscle, oblique arytenoids, thyroepiglottic muscle. Next 3 muscles include those muscles which help in closing and opening the Rima Glottidis, and that includes the posterior cricoarytenoid, lateral cricoarytenoid, and transverse arytenoid. The next three muscles include those muscles which help in stretching or relaxing the vocal cords or the vocal ligaments, and that includes the thyroarytenoids, vocalis, and cricothyroid. Muscles that regulate the inlet of larynx. There are three muscles that regulate the inlet of larynx. They are aryepiglottic muscle, which is this, oblique arytenoid, these, and thyroepiglottic muscle, which is this. Aryepiglottic muscle takes origin from the apex of the arytenoid cartilage. The fibers run in the aryepiglottic fold and get inserted in the epiglottis. When the muscle of the two side contracts, it will move the aryepiglottic fold medially, thus leading to approximation of the two aryepiglottic fold, closing the inlet of larynx. Thus, aryepiglottic muscle is a sphincter of inlet of larynx. Along with aryepiglottic muscle, oblique arytenoids also acts like sphincter of inlet of larynx. Oblique arytenoids appear as if it is a continuation of aryepiglottic muscle. Its one attachment is to the apex of the arytenoid cartilage, and the second attachment is to the muscular process of arytenoid cartilage of the opposite side. The two muscles of the two sides cross each other. The oblique arytenoid along with aryepiglottic muscle when contracts will close the inlet of larynx and thus acts like sphincters. Thyroepiglottic muscle takes attachment to the thyroid cartilage and get inserted in the epiglottis. When this muscle contracts, it will widen or open the inlet of larynx. Muscles that regulate Rima Glottidis. First, let us try to understand what is Rima Glottidis. These are the two arytenoid cartilage, and these are the vocal processes. The vocal process of arytenoid cartilage gives attachment to the vocal cords. These are the two vocal cords, and the space between the vocal cords and the vocal process of the arytenoid cartilage of the two sides is called Rima Glottidis. The muscles that regulate the Rima Glottidis, which means opening and closing of the space between the two vocal cords, are posterior cricoarytenoid, lateral cricoarytenoid, and transverse arytenoid. This muscle is posterior cricoarytenoid. This is lateral cricoarytenoid, and this is transverse arytenoid. The posterior cricoarytenoid takes origin from the posterior surface of the lamina of the cricoid cartilage and gets inserted on the posterior surface of the muscular process of the arytenoid cartilage. The origin of lateral cricoarytenoid is from the upper border of the arch of the cricoid cartilage, and insertion is in the anterior part of the muscular process of arytenoid cartilage. So posterior cricoarytenoid gets inserted in the posterior surface, and lateral cricoarytenoid gets inserted on the anterior surface of the muscular process. When the posterior cricoarytenoid muscle contracts, it will rotate the muscular process backwards, And when the lateral cricoarytenoid contracts, it will rotate the muscular process forwards or anteriorly. By the contraction of posterior cricoarytenoid, when the muscular process rotates backwards, as marked by blue arrows, the vocal process moves laterally. When the vocal process moves laterally, the vocal cords are also abducted, that is, they too move laterally. This helps in opening of the Rima Glottidis. When the lateral cricoarytenoid contracts, it will rotate the muscular process anteriorly, and thus it will rotate the vocal processes medially. This will bring the two vocal cords close to each other and will close the Rima Glottidis. So the action of posterior and lateral cricoarytenoids are opposite. The posterior cricoarytenoid opens the Rima Glottidis and lateral cricoarytenoids close the Rima Glottidis. The transverse arytenoid takes origin from the lateral border and the muscular process of one arytenoid cartilage and runs to the other. When this muscle contracts, it will bring the two arytenoid cartilage towards each other. When the two arytenoid cartilage along with their muscular processes move towards each other, it will close the intercartilaginous part of the Rima Glottidis. So it will bring the two vocal processes along with the vocal cords close to each other, closing the Rima Glottidis. Muscles that regulate the vocal ligaments. Vocal ligaments are also known as vocal cords. These are the vocal ligaments or the vocal cords. They are attached posteriorly to the vocal process of the arytenoid cartilage. Anteriorly, it is attached to the posterior surface of the thyroid cartilage close to the angle. The muscles that regulate the vocal ligaments either stretch them or relax them. When the thyroid cartilage moves towards the arytenoid cartilage, it will relax the vocal cords, thus reducing the tension in them. When the thyroid cartilage moves away from the arytenoid cartilage, it will stretch the vocal cords, increasing the tension in them. As the vocal cords relax or get stretched, the tension in them changes, which also helps in changing the pitch of the sound. As the vocal cords are stretched and the tension in them increases, it helps in producing high-pitched sounds. Muscles that regulate the vocal ligaments are the thyroarytenoids, vocalis, and cricothyroid. This muscle is thyroarytenoid. It is attached to the anterolateral surface of the arytenoid cartilage posteriorly, and anteriorly it is attached to the posterior surface of the thyroid cartilage. This muscle is vocalis. Vocalis is attached to the lateral surface of the vocal process of arytenoid cartilage posteriorly, and anteriorly it is attached to the vocal ligament and also to the posterior surface of the thyroid cartilage. When both these muscles, that is thyroarytenoid, which is this, and vocalis, which is this, when they contract, they move the thyroid cartilage posteriorly and helps in shortening the length of the vocal ligaments and thus relaxing them. So, thyroarytenoid and vocalis muscle together helps in reducing the tension in the vocal ligament or the vocal cords. The third muscle is cricothyroid. This muscle is cricothyroid. It takes origin from the upper border of the arch of cricoid cartilage. The muscle has two sets of fibers. One is the oblique muscle and the other is the straight muscle. These are the fibers of straight muscle that go straight up and get inserted in the lower border of the thyroid cartilage. And these are the fibers of oblique muscle that go obliquely backwards and get inserted into the lower border of the thyroid cartilage and into the inferior horn of the thyroid cartilage. Cricothyroid muscle, when it contracts, it will pull the thyroid cartilage downwards and forwards. When the thyroid cartilage moves forwards, it will pull the vocal cords, and as the vocal cords are pulled, a stretch in them will be created. Stretching the vocal cords will increase the tension in the vocal cords, which will help in producing high-pitched sounds. So, the muscles that regulate the vocal ligaments are thyroarytenoids and vocalis muscles, which helps in reducing the tension in the vocal cords, and cricothyroid muscle, which helps in increasing the tension in the vocal cords. These diagrams summarize the action of the muscles of larynx. This is larynx in the anatomical position. This diagram shows the action of cricothyroid muscle. Cricothyroid muscle draws the thyroid cartilage downwards and forwards. This creates a pull or tension in the vocal cords. This diagram shows the action of posterior cricoarytenoid muscle, which rotates the muscular process backwards. As the muscular process rotates backwards, the vocal process will rotate laterally. This will increase the space between the two vocal cords and thus makes the Rima Glottidis wider. This diagram shows the action of lateral cricoarytenoid muscle. Lateral cricoarytenoid muscle, which is this, rotates the muscular process forwards. As the muscular process rotates forwards, the vocal process rotates medially. This brings the two vocal cords close to each other. This diagram shows the action of transverse and oblique arytenoid muscles, which together draws the two arytenoid cartilage close to each other. This also draws the vocal processes and the vocal cords close to each other, reducing the space between the two vocal cords and vocal processes to a narrow chink. This diagram shows the action of vocalis and thyroarytenoid muscles, which reduces the tension in the vocal cords. It makes the vocal cords loose or lax. Summarizing the movements of larynx, Elevation of larynx is brought about by thyrohyoid and mylohyoid. Depression of larynx is brought about by sternothyroid and sternohyoid. These four muscles are the extrinsic muscles of larynx. Opening of the inlet of larynx is by thyroepiglottic muscle. Closing of the inlet of larynx is by aryepiglottic muscle and the oblique arytenoids. Abductor of vocal cords which open the Rima Glottidis is posterior cricoarytenoid. Adductors of vocal cords that close the Rima Glottidis is lateral cricoarytenoid and transverse arytenoids. Tensor of vocal cords which stretch the vocal cords is cricothyroid. Relaxer of the vocal cords is thyroarytenoids and vocalis. Movement of vocal cord takes place to bring about changes in the shape of the Rima Glottidis. The Rima Glottidis has two parts, the membranous part which is present between the two vocal cords and the cartilaginous part which is present between the vocal process of the arytenoid cartilage. During quiet breathing, the intermembranous part is triangular in shape and the intercartilaginous part is quadrangular in shape, so that the entire shape of the Rima Glottidis is pentagonal. During forced breathing, the intermembranous part is triangular and widely separated, and the intercartilaginous part is also widely separated and triangular in shape. Together, the Rima Glottidis is diamond shaped. During whispering, the intermembranous part comes very close to each other and the intercartilaginous part is widely separated, thus forming a funnel-shaped Rima Glottidis. During speech and phonation, the intermembranous part is adducted and the intercartilaginous part is also adducted, reducing the entire Rima Glottidis to a chink. The arterial blood supply of larynx is by two arteries, and they are the superior laryngeal artery and the inferior laryngeal artery. Superior laryngeal artery is a branch of superior thyroid artery, which is a branch of external carotid artery. Superior laryngeal artery accompanies the internal laryngeal nerve. Both the structures pierce the thyrohyoid membrane to reach larynx and then they supply the upper part of the larynx. Inferior laryngeal artery is a branch of inferior thyroid artery. Inferior thyroid artery is a branch of thyrocervical trunk, which is a branch of subclavian artery. The inferior laryngeal artery accompanies the recurrent laryngeal nerve. Both the structures ascend in the groove between the trachea and the esophagus to reach the lower border of inferior constrictor of pharynx. Here it passes deep to reach the larynx. The inferior laryngeal artery supplies the lower part of larynx. Venous drainage of larynx is into two veins, and they are the superior laryngeal vein and the inferior laryngeal vein. The superior laryngeal vein drains blood from the upper half of the larynx, and inferior laryngeal vein drains blood from the lower half of the larynx. Superior laryngeal vein accompanies the superior laryngeal artery. Inferior laryngeal vein accompanies the inferior laryngeal artery. Superior laryngeal vein, after draining blood from the upper half of the larynx, drains into the superior thyroid vein, which in turn drains into the internal jugular vein. The inferior laryngeal vein, after draining blood from the lower half of larynx, drains into the inferior thyroid vein. Inferior thyroid vein in its turn drains into the left brachiocephalic vein. Lymphatic drainage of larynx. Lymphatic drainage of larynx above and below the vocal cords is into different group of lymph nodes. Above the vocal cords, the lymphatic drainage is into anterosuperior group of deep cervical lymph nodes. These lymph nodes are present at the bifurcation of common carotid artery. Below the vocal cords, the lymphatic drainage is into postero-inferior group of deep cervical lymph nodes. These lymph nodes are associated with inferior thyroid artery. Thus, vocal cords are watershed line for lymphatic drainage as lymphatics above and below it drain into different group of lymph nodes. Nerve supply of larynx. This is the vagus nerve. One of the branches of vagus nerve is superior laryngeal nerve, which further divides into internal laryngeal nerve and external laryngeal nerve. Vagus gives another branch called recurrent laryngeal nerve. This nerve, after arising from the vagus, turns upwards, travels in the groove between trachea and esophagus to reach the larynx. Next, sensory innervation of larynx. Above the vocal cords, the sensory innervation of larynx is by internal laryngeal nerve. Internal laryngeal is a branch of superior laryngeal nerve which is a branch of vagus. Below the vocal cords, the sensory innervation is by recurrent laryngeal nerve. Motor innervation of larynx. All the muscles of larynx is supplied by recurrent laryngeal nerve except for cricothyroid, which is supplied by external laryngeal nerve. And as we have previously seen, external laryngeal nerve is a branch of superior laryngeal nerve, which is a branch of vagus. Clinical anatomy of larynx. Infection of larynx is called laryngitis. Hoarseness of voice occurs in laryngitis. Laryngeal edema can occur due to various reasons, and it may cause respiratory obstruction. Foreign objects when enter larynx initiates a severe cough response. This helps to expel the objects out of the larynx. However, during this process, if the internal laryngeal nerve is damaged, then coughing reflex is lost and the object may enter deep in the respiratory passage. Damage to external laryngeal nerve causes weakness of phonation. Paralysis of recurrent laryngeal nerve of one side causes hoarseness of voice. When both recurrent laryngeal nerves are interrupted, the vocal cords will lie in the cadaveric position. Phonation is completely lost. Deep breathing also becomes difficult. Larynx can be examined directly through laryngoscope, and this process is called direct laryngoscopy. Questions that may be asked from the topic larynx in the exam includes enumerate the adductors and abductors of vocal cords and write their nerve supply. Enumerate the muscles of larynx with their nerve supply and action. Nerve supply of larynx, in which both sensory and motor nerve supply must be written. Inlet of larynx, cavity of larynx, vocal cords and Rima Glottidis, movements of vocal cords, cricothyroid muscle, Describe the larynx under the following subheads: arterial supply, venous drainage, lymphatic drainage, and nerve supply.